Hey guys, Dr. Steph here from Living Health Integrative Medicine in Annapolis, Maryland, and I was actually specifically asked to do this video by a patient of mine who is dealing with some heavy metal toxicity and is being quite impacted by it. And he just said the other day, he emailed me and said, Dr. Steph, you really have to talk about heavy metals and how horrible they are and how people can get rid of them because of what I'm going through. So many of you that know us know that we work with various types of patients with various conditions like neuropathy and nerve damage, central nervous system issues, dementia, multiple sclerosis, and autoimmune diseases, as well as diabetes. And all of these can be impacted in a negative way and contributed to by heavy metals. And so I want to go over an example of the results for heavy metals testing. And specifically today, we're going to talk about mercury. I will talk about the other common ones that we find and test high in people in another video, so it's not too long. But the other metals that people do test high for is cadmium, lead, and arsenic. And arsenic is very, very prevalent in the Maryland area, especially in Anne Arundel County. But we'll do another video on that so we can deep dive into that. But today we're going to focus on mercury. So we work with a lab called Quicksilver Scientific, and the lab test that we do is blood mercury tri-test. So it's blood, hair, and urine, and that allows us to measure the different forms of mercury that are in the body, in the blood, which I'll get into in a second, but also how well the body's actually able to excrete it. Because if we were ingesting or intaking heavy metals and able to actually get rid of it, then they wouldn't impact us so dramatically. And it can also help me as a provider know, oh, this person needs some extra kidney support or liver support, depending on, what that shows. So I'm just going to go over the mercury findings. This is just an example of how the results come back to us, so that you can kind of see on the sheet here. And what we find, let me just kind of move my mouse here. Here we go. Is there's three, bar graphs on the first page of the mercury test results. And these are the results from the blood. And one of them is called methyl mercury. And then the other one is inorganic mercury. And then there's a totals mercury. And in this case, the dark blue line is that patient's level of mercury in the blood. And the gray line is the average for the Quicksilver labs. So, and they do a lot of heavy metals testing. You do not want to be above their level. And then the only one that's a total that's different is this white bar here. And this is the CDC's average. So when we look at total mercury, we can compare your levels to both the Quicksilver labs averages as well as the CDC average. So methyl mercury, this is the mercury that people will more commonly consume in fish, and it's bound to carbons. So it's the mercury that is already in that organism's tissues. It's very lipophilic, meaning it binds very easily to fat. Remember, fat is chains of carbons. So when mercury actually gets taken into, for example, a fatty fish, and it actually kind of infiltrates the tissues, it's now bound with carbons. It's in its methyl form, and it's an organic form. And this is a highly, highly toxic form of mercury. And then inorganic is more in its straight metallic form, or it's bound with other things that are not carbon. So it creates salts, right? So when you think of that, you think like metal amalgams. So the metal that people have in fillings, and yes, they are still doing metal amalgam fillings in present time, which makes me crazy. I can't believe we're doing it. But the metal that's in that is 50% mercury roughly. And then there's other things in there like nickel and other metals, because mercury is liquid at room temperature. So you can imagine if you're putting mercury into a warm body versus room temperature, there needs to be some other harder metals mixed in to create an alloy to actually create a good filling. The problem with the fillings is that when you chew and talk and kind of grate the teeth and grind the teeth, you actually will have mercury vapor go out of the filling itself, and you're either going to be breathing it in or you're actually going to swallow it. And an NIH researcher who's probably one of the leading researchers with regards to mercury and its effect on brain and its contribution to dementia, Alzheimer's, is a 25-year veteran of the NIH, and he actually tested this himself with a vapor measurer. He was able to measure the amount of mercury, and he actually found that when people are just chewing their food, that the mercury gases actually increase. So your level of inhalation of mercury, the inorganic, and then swallowing it, in that way from the amalgams can convert the inorganic into the methyl or organic form, and that will more likely absorb into tissues. The thing with elimination of mercury from the body is inorganics a little easier to get rid of than methyl form, because methyl form is very, very easy to get into the brain, into the cells, into anywhere where there's a lot of fat. So your nerve endings, this is why it's a contributory problem for neuropathy. So that's when we look at this example, we see that mercury levels are very high. They're higher than all the averages between the CDC and the Quicksilver Labs for all forms, but especially the inorganic, very, very high, getting into the red zone here. So in this particular case, this would be something that could be correlating with a person's condition, and we would definitely want to do some chelation work to help get rid of it. And we'll get into kind of what that looks like in a minute. The bottom of the page, now we're looking at the urine. Remember we said we get it from urine, and we also collect a hair sample because the body will eliminate heavy metals through the hair and it will eliminate through the urine. And so we want to see that amounts of metals are in the white zone, or at least on the line, because that tells us that the person is actually able to eliminate. What's interesting is when you look at metals this high, and I see someone is definitely urinating it out, because that dot is telling us that it's not just stuck in the blood, there's a likely current exposure going on. And in this case, with the inorganic being so high, we would be suspecting that a person has a lot of metal fillings. Or maybe the person actually just got a bunch of metal fillings out and got a big exposure. Either way, we want to be, working to eliminate that, and we know that this person is able to actually eliminate pretty efficiently. So as far as the importance of getting rid of mercury, this just explains what I kind of explained earlier, the difference between inorganic and organic. So organic is the mercury that is bound to carbons, so that it is very much bound to tissue that is in your body. And it's very easily stored and taken into cells and into the brain, which is why it can be so toxic for people, even more so than the inorganic form. But just remember, the inorganic form can convert in your own body. So the inorganic form is more like the metals that, like if you were working in a place that used a lot of mercury in its metal form, its salt form, not in animal tissue or anything like that. And it's usually inhaled. So that could be industrial areas. If you're working with a lot of industrial chemicals, if there's mercury in that, you could be getting exposed to it that way. But the most common sources for people are food, mainly fish, especially large fish. So the larger the fish, the older the fish, and the more mercury it's been accumulating. And that's also true of us. The older we get, we start to actually see that people are accumulating and not eliminating higher and higher amounts of mercury, which again makes it very important for us to look at eliminating it from the body. As far as symptoms, mercury poisoning symptoms, lack of coordination, muscle weakness, hearing and speech difficulties, nerve damage in your hands and your face, vision changes, and trouble walking. But this is mercury poisoning, and we could be actually becoming slowly poisoned incrementally over long periods of time with low chronic exposure that just slowly starts to build up. And many people's disease complexes and symptoms that could be related to mercury exposure may never be tied to mercury exposure because someone didn't have a big obvious, mercury, exposure, a known exposure, other than possibly it's in their water, they're eating too much, tuna. Tuna is a very large fish that is commonly known to be high in mercury. So if you're eating tuna many times a week, you could be actually exposing yourself to greater amounts of stored mercury in the body. And then, of course, the metal fillings. This is a paper that talks about mercury and neuropathy, and this is important. This is why we standardly run on all of our neuropathy patients heavy metals tests to rule this in or out as a possible contributing factor. So peripheral neuropathy from mercury exposure most commonly involves distal sensory for short-term exposures, and then long-term exposure starts to affect motor neurons. This is where balance can start to be affected in addition to just the loss of sensation or the altered sensation. And so central nervous system effects are more common with organic mercury exposure. So this is the fish. This is metal fillings that you end up swallowing some of the inorganic and it becomes mercury, methyl mercury in your body. But this is where, eating large amounts of contaminated meats, fish, foods, where mercury is in an organic form, that's more likely to cross the blood-brain barrier and get into the immense fatty tissue of the brain. And it just makes it really important, again, to look at testing for this stuff and to get it eliminated. So if you are looking at getting your metal fillings taken out, or if you've done that already, or then you want to make sure you're getting tested at some point for what your metal levels are. And then you need to actually go through protocols to help pull these metals out, because they, especially the methyl mercury that gets into brain and nerve tissue and fatty tissue, it's once it's there, it's kind of embedded there, and you need to do a lot of different things to coax the heavy metals out. And then you also need to make sure you're protecting and taking things to protect the organs while you're trying to get these metals out, basically, generally, through the most part, through urine. And then this was just a paper I wanted to show you also, that mercury exposure has been somewhat implicated in worsening of insulin resistance and diabetes. Mercury is very toxic, and if it gets into cells, it can start to mess with the cell's mechanisms and the cell membranes, and it can start to affect how the cell actually metabolizes sugar, and you can become obviously metabolically in trouble with exposure to mercury specifically. So what we do is we essentially, when we test, and anybody can get this test. So if you feel like you've got, brain fog, fuzzy thinking, neuropathy, anxiety, depression, you have a lot of metal in your mouth, or maybe you've had metal taken out, or you're not 100% sure. Another actually form or source of mercury specifically is flu vaccines and other vaccines, and it's in a form called thimerosal, which is actually, it's a toxic form of mercury. It's used as a preservative, and that's injected right into the bloodstream, and that's another actual source of toxicity. And we are, really bombarded with vaccines almost on a annual, monthly basis now. So that's a consideration as well. If you do have an extensive history of getting your flu vaccine all the time, and you're just kind of noticing brain changes, cognitive changes, nerve changes, balance changes, or you just are curious as to whether or not your metals are elevated, then anybody can come in and get this test done. And so we look at this test, we say, look, this person's got definitely high mercury. So we are going to put together protocols using many of the Quicksilver supplements. We have some of our own that we bring in for organ support and brain support, general tissue support. And we're gonna do some pretty extensive protocols to help you actually release the mercury and be able to eliminate it in an effective way. So we have, it may take a round of 6 weeks to 12 weeks of various supplements on a rotation. We give you things to remineralize, because if we give you things to pull metals, sometimes these things are not, only pulling mercury, they're pulling lots of different metals. So it's all about kind of pulling and restoring the healthy, pulling the toxic, restoring the healthy, and then getting you to where we can retest. And once we get a person testing back their mercury levels low, especially below the average, and symptomatic change, then we know that we're in the right, we've done the right thing. Sometimes we've done a heavy metal round of chelation, and we do the retest, and the numbers are actually higher. And that can happen if the person is still pulling metals out of tissues. And so it's really important that we do another round, and we keep going until we get these numbers down. And remember, it can take years and years and years to accumulate these things. So this should not be something that you have to do every year. This really, if you're 50, 60 years old and you've had your metal fillings taken out, and you're really, really diligent about, not eating tuna every single week, and you're able to limit the sources of mercury, then, there's no reason why you should have to be doing this again if your levels were really that high and we were able to get them down. So this is not something that people have to do all the time ongoing, like we do, sometimes fasting and lemonade fasting and reboots and things like that. This should be, once we've done the job, we've really done the job. It's very important also to know that another source of heavy metals is chemotherapy. Chemotherapy is very high in toxic metals. That's part of what makes it work. So again, some of our patients with neuropathy, they come in for neuropathy program, and they've had a history of breast cancer and lots of chemo rounds or any kind of cancer. It's not uncommon that we see heavy metals to be quite high. And so it's very important that we pull those, because they have chemo-induced neuropathy, and it's because of the toxins and the metals in the chemo, usually in part. So we've gotten great results with, previous cancer patients that have had chemo, with getting their chemo-induced neuropathy into remission with doing the heavy metals protocol. And again, we look at this for all neuropathy patients, all of our cognitive impairment patients. And it is something, if you haven't had tested with us, you're more than welcome to do it. And we've gotten very, very good change pre and post, not just with the metals test, but like I said, with their actual symptoms or whatever they were here for. We did some pretty extensive heavy metal chelation, quite a few rounds with a patient who had cognitive impairment, and it showed on the MRIs and it showed on the functional tests for brain function. And, we were able to go through, get her put through the heavy metal protocols, and we're actually seeing improved brain volume on the MRI and improved executive function as far as brain function goes. So she's actually reversing the aging of that brain, given part of what we did. Obviously, we were doing other things too, but a big component of that was doing a couple rounds of the heavy metals chelation, because she had pretty high amounts, and also had a recent filling situation handled. So that is an overview of the heavy metals test, in particular the mercury, and why it's so important to eliminate mercury. And on an upcoming video, I'll get into some of the other heavy metals and the symptoms that they cause and the sources, because it's important to know where these things are coming from. But it's also important to know that you actually can get rid of these, but it will take a little bit of strategic protocols in order to bind the metals and safely get them eliminated from your body. All right, guys, see you later.